Welcome back, David Hertel in for Elias. In what may come as a chilling shock, it seems that our ever-growing housing crisis in Canada is impacting the opioid epidemic in the country. And if nothing is done to curb the effects on Canadians, then it may have deadly consequences. But just what is the solution? Happy to be joined by Dr. Leslie Buckley, Chief of the Addictions Division at the Center for Addiction and Mental Health. Dr. Buckley, thank you very much for joining us this morning.
Oh, thank you so much for having us and, for shining a light on this topic.
I think we're not doing enough, actually, to shine. We need to talk about this so much more. So, first of all, put this in context for us. I mean, how bad is the situation right now regarding the opioid epidemic in this country?
So, what we're seeing in terms of, what we're calling the opioid toxicity deaths, because, the supply is so toxic, it's really beyond a crisis. It's a tragedy. We lose, 22 Canadians per day to these opioid overdose deaths. That's 3,970 from January to June, the first half of 2023. And it's not slowing down.
So when we talk about opioids, maybe help us because we hear a lot of different names, different drugs. I mean, so what are we talking about when we talk about opioids? What are the most prevalent kind of opioids that are out there?
Well, that's a really good question because I think a lot of people aren't sure about that. So, what we know is responsible for most of the deaths is something called fentanyl. People probably heard that, and it's so dangerous because it's so incredibly powerful. Really unlike anything we've seen before, including heroin. There's also, heroin, which people are probably familiar with. But opioids are also, pain medications. So pain medications that people use, for treatment, for chronic pain, are also, sort of used for different reasons, for more recreational purposes. And that can sometimes lead to sort of an escalation in use and maybe at some point a shift to an even stronger opioid.
So is that the most, let's just say, the most obvious path to addiction? Is like you start off using opioids for pain. It's prescribed legally for treatment, and then there's an addiction that begins. Is that the most usual pathway to addiction?
I wouldn't say it's the most usual. I think like the majority of people who are, treating their pain are doing it, in a safe and sustainable way. It's one pathway, that was probably most prominent during the OxyContin issue. So I think that what we're seeing, we don't necessarily know exactly the pathway that people are taking to opioids, and we are working on that in terms of research. But I think there's very different pathways that people take, including, maybe a pathway through various substances like alcohol or cannabis. But sometimes directly to opioids. So it's different for everyone.
Okay. So there are some people advocating for decriminalization, safe supply. What are your thoughts on these proposed solutions?
Sure. So, decriminalization has certainly been in the news a lot. And there's been a broad, fairly broad consensus that, decriminalization is the right direction to go in terms of not charging people for simple possession. And the purpose is to, shift from a legal lens to a health lens because we know that addiction really is a health issue. And, it's really hard for people to be saddled with charges when they're really trying to work on their recovery. But on the other hand, we have to balance this with community safety. And I think that's what's coming up in some of the pilot programs that are happening in the U.S. and in B.C., that there's some concern with public use. And so we need to really look at these models and evaluate them and try to figure out what would work best.
So today, as you know, is Bell Let's Talk Day. There's definitely mental health issues linked with these types of dependencies and addictions. My question is, how do we recognize the signs? Let's say if we have a friend, family member, we're wondering, we're not sure. I mean, what are the telltale signs, or how can we get to the bottom of this if we feel something's wrong here?
That's such a good question. So there are definitely, some flags. Sometimes people can be surprised when they find out a loved one has been using substances, and eventually, sort of show up in different ways. So one could be, failing in certain roles. So whether that's their ability to sort of complete their workplace duties in the same way, they might notice their mood is changing and that they might be more cranky or irritable or seeing a lot of ups and downs, or changes, in sort of personality and, sort of coping at a different level than they did before, just having difficulty managing. And, sometimes that this is something that people don't see at all, but sometimes it's very obvious to family members.
So what can we do to help? I mean, what would be the next steps? Once you think you're pretty sure if you actually had the conversation and we're looking at a case of opioid addiction, what can we do?
So I think the first step is to not stigmatize. So, it's so important to think about stigma, and we've made a lot of progress here. So, and most people probably know somebody who struggled with a substance. So we have to recognize, that not to be judgmental, and we don't really want to ask, how come you can't stop using? We want to ask, how can we help?
That's very important. And then what would be who can we reach out to? Is it the healthcare system, specialized clinics? Where do we go?
So it depends on where you live, but a family doctor is always a great start, but not everybody has a family doctor. But we also have, so many resources and clinics that are available, including something we call RAM. So that's RAAM, Rapid Access Addiction Medicine. And, you can generally, this is a great model. You can walk in anytime, any day that it's open, and you don't have to have an appointment, and you can get started that same day with the treatment plan.
So there are treatments out there.
There are treatments out there. Yeah, and we need to promote that.
Yeah.
So anyone listening, people sometimes think, oh, I've got this, or it's so early on. We know if we could catch people earlier, it would really help a lot.
Well, Dr. Buckley, I really appreciate your time and thank you for working on this and your service, you and your team. And let's hope that we can put a dent into this crisis.
I couldn't agree more. Thank you so much for having us.
All right. Take care. Dr. Leslie Buckley, Chief of the Addictions Division at the Center for Addiction and Mental Health.